Today's program is Checklist Guide to Performing an Audit. And the information that we're going to talk about today is for educational purposes only. The American Institute of Healthcare Compliance is a licensing and certification partner with CMS. And we are not licensed as a legal firm or as a consulting firm. So this is just for discussion purposes, and things that apply directly to your organization or your job would be much more specific than what we can go over in general today. My name is Joanne Byron. I have actually quite a bit more than 35 years of clinical and executive healthcare experience, but I am experienced at doing both internal and external audits. Okay, let's talk about what we're going to discuss today more specifically. And we're going to talk about planning, executing, writing the formal written report, and then what's involved in corrective action if that also falls under your job description as an auditor or a lead auditor. I'm going to start off with a polling question. So I'd like for you to answer, to give me an idea of who you are and what kind of audience we have today. Polling question number 1. Did you have the opportunity to attend last week? We had a 1-hour free webinar where I discussed with the attendees an introduction to auditing for compliance. We had a nice crowd of people, really good questions, and this is more of a follow-up to that. So if you're new to auditing, some of this might be confusing to you, but if you attended last week, that was going to help prepare you for today's program. A little bit more than half attended last week, so thank you for coming back. And 48% said no. So I hope I can impress you today and that it will be a good discussion for you. I have one more polling question for you. Have you completed training in the American Institute of Healthcare Compliance Certified Healthcare Auditor course? Because if you have, that helps me to know if I'm speaking to people that have been certified through our organization. And if you've maintained your credential, or if you've let it lapse and you're just coming back today for an update, or no, but you do have an audit credential from another organization, and that's fine. We welcome you to come to our free webinars. And if you have no formal training at all, okay, so if you've completed the training, yes or no? If yes, do you have your CHA or CHA credential, or did you let it lapse, which is fine? And if you have an audit credential from another organization, that's wonderful, because having credentials really does help show that you have obtained some formal training and was able to pass a competency certification exam. It's employers and contractors like to see that. And if you've had no formal training in auditing, that's fine too. Coming to a free webinar might give you some information to help you make a decision whether auditing as a career is something right for you or not. I'm going to end the poll at this time and share the results. So 17% say yes, you have the credential. 1% says you've let it lapse, and you can get reinstated, by the way. If you go to our website and click contact us, you can ask how you can get reinstated. No, but you have a credential from another organization. We're glad that you're here. And 62% says you have no formal training in auditing, and we're really glad that you're here, because this should be hopefully very informative for you. Okay, let's see if I can go to the next slide. There we go. All right, let's start talking about PERC. An audit project has 4 phases. And what we teach in our course is the planning phase, execution phase, the report audit of reporting your audit findings and corrective actions that are usually based on root cause analysis. So whether you personally perform all the phases of the audit or not, someone on the team is responsible for each one of these phases of an audit. Whether the audit team is called upon recommending corrective action or not, the organization is responsible to correct mistakes and nonconformances reported by the audit team, even if you are an audit team of one. What we discussed last week is that even if you are the only auditor, you are also the lead auditor, that there are leadership skills that you need to be able to perform various tasks of a successful audit. And there was a question from last week that I don't think we had time to cover, but they asked, what if you find overpayments? Don't you have to return and refund those overpayments? And that's part of the corrective action plan. You report your findings, and auditors plan, execute, and report. You aren't responsible for what happens next. You're responsible for doing an objective audit, reporting your findings, and the organization has a responsibility to take corrective action, and that is determining if you have to self-report, if there are overpayments that need to be returned, or if there's other consequences that need to be handled. But the auditor typically doesn't go in and solve the problems at the end, but you may be asked for your opinion on how to move forward with corrective action. As we begin to cover the phases of an audit, please always remember that the focus of every audit is to measure risk by determining nonconformances. Don't get sidetracked by situations which are not part of the audit, although you may come across issues that need attention. Now, in those cases, report your observations to the appropriate party and then get back to focusing on your audit task. The biggest compliment an audit team can receive would be what? For those of you who are certified should know the answer to this. The biggest compliment you can be given is that the audit was fair, that you conducted it professionally, that people feel that you were very fair, even if you show that there are a lot of areas that need improvement. But did you do it in a fair and objective manner? Now, all of the requirements illustrated on this particular slide needs to be addressed, including anything that could compromise the quality of care and safety of your patients and your workforce. So what are the requirements and rules? What are the standards? What are the regulations? What are the policies? What are the laws that apply to your type of organization? And then you are going to go ahead and audit against those written requirements. Auditors never create the standards to be audited against. That would not be an objective audit. That would show a conflict of interest. So let's start with the planning phase. Determining what type of audit are you doing? You need to be clear. And then what are the terms for accepting the audit? Can you identify or describe the audit and then prepare to actually do the audit? Those are the parts of the planning phase. So the checklist has all of these things in it. So when you download it, you could go ahead and take a look. So determining the type of audit, and these are just examples. Is it a coding and documentation and billing audit? Are you auditing a process? Are you auditing a system? You can't audit something that isn't functioning and already in place. So it has to be an established system with criteria to audit against. And then is it a compliance audit or a performance audit? Is it a first, second, or third party audit? Are you performing this as either an internal auditor or as an external auditor. We'll talk about that more in a minute. Have you verified that there's an established system or process to audit? Let's talk for a moment about if you're employed and asked to perform an internal audit, then that would be considered as a first-party audit. Now, if your employer is asking you to audit HIPAA compliance of a business associate, that's an example of a second-party audit. Third-party audit example would be acting as a consultant to conduct an audit for CMS. And I've done that before. I've done all three of these types of audits. It can be a payer or a certification body to verify the provider is compliant. An auditor always uses established guidelines, policies, and systems to audit against. Terms for accepting the audit not only apply to external or third-party audits, but they can apply to an internal audit as well. So let's say you're asked to audit documentation, coding, and billing for Dr. Smith this month, for example, one of the surgeons in a multi-specialty clinic. However, you developed and executed the documentation training for Dr. Smith 2 years ago when he joined the practice. Would that be a conflict of interest? Yeah, it would be, because you have a personal vested interest in wanting to look good, to having Dr. Smith do a good job, because that reflects back on you. Other terms for accepting the audit: are you available? What happens if the audit assignment is, okay, Joanne, we need to get the audit done by Thanksgiving week, the day before Thanksgiving. Let's say you only have 30 days to get the audit done. And you find out that you need to assemble an entire team, that it is a huge audit, and it's going to take more than 30 days, not only to plan it and execute it, that's going to take a couple of weeks after the audit is done to write the written report. So if you're not available to meet certain deadlines, you need to take that into consideration and have a discussion before you say, yes, let's go forward with the audit. You need to take a close look to see if there's any conflict of interest, and are you competent? What happens if you are asked to be part of an audit team and your responsibility is looking something at very specific, and you don't have expertise, you're not a subject matter expert in that area? Then you need to tell the lead auditor or the person assigning that to you that there's an issue here, it needs to be worked out before you just jump in. Do you have the full support of upper management? We talked about this last week. C-suite executives, boards, providers that own the practice. You need to make sure that they're going to be behind you, so that when you run into resistance in performing and executing the audit, you have some support and backing. And you need to make sure that you're going to have access to all applicable records and the appropriate personnel that may need to be interviewed as part of the audit process. Another part of the planning phase is identifying the audit. The when, who, what, where, and why are we doing this? Get specifics about who is requesting the audit and when it needs to be completed. Where is the information located? Can you get access to it? If you have to do a 6-year look back, are some of those records off-site or with a storage facility? How long will it take for you to get access to that information? Make sure there are realistic deadlines and that you have sufficient resources allocated to meet those deadlines. Preparing before initiating the audit, it really does save time and streamlines the entire process. So put the time up front to get all this planning done. It's likely that the sample size and how the sample will be selected will be part of the project request. If not, then you may have to have several methods of how sampling will be done, what the sampling plan is going to look like, and you may have to ask for pre-approval, and that's going to take time. You then select the method that best suits the needs of the project. For chart audits, there's the OIG rat stats, there's other sampling generators or random number sampling tools. If you're conducting a focus monitoring audit, then the approach taken to select the audit items may differ. So let's talk about the audit plan documentation. You're going to document what is the purpose, the scope, how broad is it, standards that you're going to use to determine if there's a nonconformance. Who are the teams? The title of the professionals. You don't have to put names, but who needs, what kind of expertise do you need on the team? What are the deadlines, your objective and goals, the requirements, and then you're going to develop a checklist. You're going to create gap analysis or other methods to determine the nonconformance. You need to plan ahead of time regarding data collection, the type of data that's required, where it's located, and the sample size. Does it need to be statistically significant or not? Is it going to be random or not? And then do a sampling plan. You're going to identify parameters, the range of possible values, the required resolutions, how and when samples are going to be taken, select the sample size, and how will the data be collected and stored. And remember, HIPAA, everything has to be secure. And have you assigned roles and responsibilities for your team? According to most project management experts, a project has three major constraints when you are executing an audit: time, quality, and cost. The execution of the project, well, it can be complex and time consuming. So never just jump into the execution phase without making sure you've done all of the planning ahead of time. You need to plan out how you're going to execute it. You can run through this checklist that's on this slide to ensure you're not skipping over an important aspect of how the audit should be performed. So let's look at each item in more depth. Is attorney-client privilege something that needs to be considered? I was doing an external audit for practice, and the RCM, the revenue cycle manager, asked me to come in, and the practice owner said that was fine. And they were asking me to take a look at certain things. The revenue cycle manager felt that there was some fraud and abuse going on. So the first thing I did while I was talking with them is perhaps we should go under attorney-client privilege so that information within the audit wasn't discoverable without going through the attorney. They said no, it was fine, just go ahead. Well, we did go through everything. I found multiple issues. I was careful how I did the report of findings because it was not under attorney-client privilege. Later down the line, they were investigated for fraud and abuse by the DOJ. And I was extensively questioned in regards to the audit. The DOJ's office found that I was very fair and objective, and the advice that I gave them was appropriate. I was not held responsible for them not taking action on any of the nonconformances that I found. And I was actually told, good job. And the practice only went to prison. In this case, I did not have to be called in as an expert witness, but there are cases where I have been called in as an expert witness because of an involvement as an external auditor. Okay, so let's take a look at execution activity checklist. We're going to go through some of that information. You need to, on the checklist, there's setting priorities, evaluate audit documents, perform the audit, document information and observations, and then you need to record the nonconformances. So attorney-client privilege, remember that when utilizing services for audits relate to self-disclosure, or when you're engaging with an outside consultant, I highly recommend you talk to your attorney and have the engagement go between the external auditor and the attorney on behalf of the practice or the healthcare provider. It's the best way to go. The attorney will know how things need to be conducted. Execution activity, once you're cleared to proceed, it's important to organize the recorded standards used as audit criteria. Now, this is the information that you compare to what is actually being done, and then you schedule an opening meeting to develop a rapport with the auditee. A lot of inexperienced auditors do this. They just jump in and, having that face-to-face and having somebody say, I don't want you auditing me. Who do you think you are, coming in and looking at what I'm doing, how I'm doing it, and telling me if I'm doing it right or wrong? Get it done with at the beginning. This is where having C-suite executives having your back is going to really help. So yes, you're going to hear resistance, complaining, even some anger, but this is where your people skills need to kick in, and you need to have your leadership skills on how you can influence people to see that this is objective, that this is to help everybody to improve, and that when everything that they tell you is not in confidence, but will be noted, and their feelings will be noted, and that you will state everything in an objective and professional manner in your report. Your personal opinion doesn't matter. What you personally think doesn't count. All that matters is that you are evaluating what's actually going on and comparing it against to what is supposed to be going on and reporting that. Nothing more and nothing less, and not your personal opinion. What matters are the facts and the objective manner you present them. This communicates fairness. During the execution phase, setting priorities is a must. Are there limits? Identify key result areas, list priorities and time limits for each. Think about utilizing the Pareto principle, which is helping you to sort through. It applies the 80-20 rule, where 20% of the work actually produces 80% of the results. So you're going to want to focus in on that 20%. So simply stated, the Pareto principle is the observation that most things in life are not distributed evenly, and it's a rough guide about typical distributions. What type of documents will you require to inspect? Is the audit on-site? Are you doing it remote? Do you have the written policies, procedures, guidelines, or regulations you need to audit against? You should know that before you actually start, but you might be in the execution phase and actually performing the audit and realize that there's some additional things that you need. The purpose of an audit is to collect objective evidence regarding the effectiveness of a specific system process. In general, these audits should be dynamic and practical tour through the business management system along a path that's prescribed by the auditor's program and checklists that are aligned with the audit objective. Interviewing workforce members, that is an excellent way of gathering information. Use how, what, why approach, and the why. You keep asking why until you get some answers. Observations are what you see, what you are told, and what you found after inspecting the documents, and map out your findings. Examples we teach in our auditing course are utilizing the fishbone diagram and using a gap analysis approach. Those are two things that are very handy management tools and map things out. And then I include those in my report of findings because sometimes a picture can be worth a 1,000 words to the reader. Recording nonconformances meaning that we report the facts, not what you think. Your personal opinion should not appear in your report of findings, ever. Have the facts to back up any chart, graphs, and information you intend to use in your report. So let's say that there is only a 72% accuracy rate in the documentation of the provider when you compare it to the codes that the provider chose, that the codes and the documentation just don't match. You use appropriate words to map that out. The person reading it is going to see that improvement is needed in the documentation. You don't need to say, only 72% of the time, the provider is choosing codes that support his documentation. And the 28% of the time, the doctor's wrong. The doctor's inaccurate. The doctor is blowing it, or, whatever emotional words you want to get into. You've got to be careful. State the facts, not opinion, not what you feel. Let the reader determine the severity of your findings. Now, in drafting your report, think about the audience. In addition to the compliance officer, who else is going to be receiving copies of the report? It's a good practice for the auditor to look at an audit from the eyes of the auditee. In most cases, associates are not accustomed to being audited, or they may have had a bad experience with an untrained auditor in the past. There may be a great amount of fear or apprehension in the associates being audited, resulting in anxiety about the results. They're going to be agitated, anxious. There are many reasons for people to have these feelings. When being interviewed, you're going to find that people may feel that the success of the audit rests on their shoulders. They may be afraid that a wrong answer may cause failure in their area of the audit. When you run into these situations, an associate may be hesitant to share information with you as the auditor. Hopefully, the successful execution of the audit is going to help to ease these anxieties. One of the important things going back to the planning phase is meeting with the auditee up front, letting them know how it's going to be conducted, what you're going to be looking at. Do they have any questions? And try to work through some of those anxieties before you actually get started. Reporting activity checklist. Audit team meeting. You're going to get together with your team, even if it's an audit team of one, you're going to get together with yourself, verify your results, share the results verbally with the team, consult with an attorney before drafting the report of findings if self-disclosure is a possibility, and then don't exaggerate. The numbers themselves will speak loud and clear. You don't need to exaggerate. And then drafting the formal audit report, never make assumptions. Try to be positive. Start the report with an overview. Don't make people look through pages to get to the bottom line. State the bottom line up front, and then go through and provide an executive summary, and then have all the facts within the report that support your findings. Make sure you're using appropriate formulas and make sure calculations are accurate. If you say, I use Excel, well, you know what? If your formula isn't correct or your cell range isn't, if it's all hosed up, I worked for an accounting firm for a while, that can happen. We had checkers and footers, and there's ways to double check everything. You need to check, double check, and make sure that all of your charts, graphs, formulas for accuracy rates or error rates are appropriate. And don't compare one physician to the results of an entire clinic. Be careful how you make comparisons, that they're fair. Making sure that there is no bias. So you have to make sure that you've analyzed the data appropriately. The lead auditor, you're the one that needs to be prepared statistically to report the findings. Is the analysis qualitative or quantitative? A qualitative data pertains to or concerns quality without regard to quantity, and thus by its nature is more difficult to measure. Now, quantitative data, on the other hand, is susceptible to measurement and lends itself to be the data of choice in the evaluation of a process based on the results of an audit. Now, the lead auditor must also have the capability of understanding statistical results from consultants or insurances when reviewing results from outside audits, calculating error rates, accuracy ratios, and breaking down findings into numeric values is an important component of the report of findings. You're going to want to look at relationships and statistical significance. Are you creating a flow chart relevant to your topic? Flow charts, charts and graphs can really help illustrate something that might take a couple of paragraphs to explain, but then you show a little chart or a graph and it kicks in to the reader, to the audience. They see what you're getting at more quickly. And have you trace the process forwards and backwards? That's also very important. Now, a picture is worth 1,000 words. And we talked about including charts and graphs to illustrate your points. Benchmarks are an important aspect of auditing. Internal and external benchmarks. For instance, if you had a baseline audit, now you're monitoring for improvement, you might want to use an internal benchmark. Here's where we were 6 months ago, and here's where we are now. And how does that compare? You might want to use external benchmarks. MGMA has a lot of different types of benchmarks that you can purchase. They have data. There's also universal benchmarking that compares a company's results with high performers, regardless of their industry size, geography, or products. An operations-focused benchmark analysis that can provide a high-level assessment of where to look for improvements. And based on the assessment findings, the key indicators can be selected as dashboard indicators in the monthly reporting to track improvement progress. Graphic illustrations, like we talked about, charts, bars, graphs, pie graphs, or a bell-shaped curve. Bell-shaped curves is something that we see when we are looking at E&M, for instance. That used to be a great illustration that CMS used and payers used to use. Now, E&M documentation criteria has changed dramatically over the past couple of years. And so you need to make sure that you are using appropriate charts and graphs that reflect current trends and current expectations. So understanding how to use formulas, that is necessary to perform these functions, and accuracy and reliability of the reports, that's going to lend credibility to the entire audit endeavor and to the reputation of you as the lead auditor. You make a mistake, everybody can make an honest mistake. You make a major mistake or too many mistakes, and you lose your credibility with your audience. And providers, once you lose their confidence, it's really hard to buy it back. So you want to make sure when you're putting everything in writing that you can back everything that you're reporting. Bar and line graphs, as well as scatter plots, can be used to record individual data values as marks on a graph. This slide demonstrates a line graph of non-conformances by month per location. So let's say we have a practice, a clinic that has East Side, West Side, Central, Uptown, and Downtown locations. lines are drawn so that independent data are on the horizontal or A axis, which represents time, and the dependent data are on the vertical y-axis. Line graphs are used to track changes over short and long periods of time. We teach all of this in our course, but this is just an example of how you can show that downtown is very different, for instance, than the West Side. Executive summaries, they're really important. It's give me the bottom line. I'm a busy CEO or COO, or even the compliance officer might say, just give me the bottom line. An executive summary should be very pertinent, fact-driven, no personal opinions in it. And the checklist here is really helpful to make sure that you are documenting everything in the executive summary and in the report of findings that people would want to know upfront. Severe noncompliance, potential fraud, abuse, or other discoveries should be discussed with legal counsel prior to writing the report. So you go in thinking, okay, this is just going to be a routine audit, and then you get in and you see that there's some really potential consequences here. Before you start to write up the report, you're going to have your notes, you're going to have your findings. Remember, what you say in between the lines and what is not said can be powerful and also could be misunderstood by the recipient. So you talk to legal counsel. Auditing, by its very nature, looks for areas of noncompliance. It's really important that the auditor provide a balanced report. Identify the positive things. You're always going to find some positive things, as well as the nonconformances or the negative aspects of the system or process that's audited. If corrective action is something that you are drawn into, you need to know how to handle it. Many healthcare provider organizations place the burden of digging into the underlying cause or the root cause, resulting in the nonconformances can fall on the lead auditor. Corrective action plans are required after an audit is completed for the purpose of documenting the root cause and contributing factors to those nonconformances that you identified. Now, a lot of times the compliance officer or department managers might get involved. It's better to have a team to do the corrective action phase, but you want to take a look at doing an activity checklist, performing root cause analysis, safety assessment code, event flow diagramming, cause and effect diagramming, audits related to overpayments. You're going to want to identify the overpayments, corrective action plan, and then a plan, do, check, act cycle. Corrective action plans should be used as a roadmap to create training, education, and project plans to be implemented to address nonconformance appropriately. Before recommending corrective measures be taken to remedy a more complex nonconformance, it might be necessary to perform a root cause analysis or an RCA, and that's to help ensure recommendations are on target. Fundamentally, RCA is when a team conducts an investigation of the direct or original error that led to an adverse event. In healthcare, this type of analysis is typically reserved for tracing the origin of serious adverse events. Adverse events are untoward incidents, therapeutic misadventures, iatrogenic relating to illness caused by medical exam or treatment, type injuries or other adverse occurrences directly associated with care or services provided within the jurisdiction of a medical center, outpatient clinic, or other facility. So a lot of times you're going to see RCAs done for clinical reasons, but you can do RCA for financial things too. For instance, there was an audit that I performed where documentation and patient care all seemed to be very pertinent, very targeted, very in line. but weird codes were going out. Found that the charge ticket that the doctor was using to check off the diagnosis codes had been created by an external source and never updated. So the patients were coming in and the CPT codes and the E&Ms were looking good, but the patients had these weird conditions that weren't recorded. We did a root cause analysis and found out, and it was not what we expected. But we were able to get down to the bottom of what caused it. And we were able to implement something so that that type of error didn't happen again. Then we had to go back and do a lot of corrective action in regards to damaging information that went in people's claims and in their records that didn't belong there. Safety Assessment Code, or a SAC. It's a method for determining whether any further definitive action is required concerning a particular type of incident, and it's based on the severity of the incident and its probability of occurrence. Now, it's a level of subjectivity, and that's judgment involved, so it's very important that you have appropriate parties on a team that all agree on how this is being done. And then event flow diagramming helps the root cause analysis team identify what happened in the event. And it's one of the critical tools for many process improvement activities, including RCA investigations. The three steps that depict the diagramming process: the initial, the intermediate, and the final. And we go into a lot of detail on this in our certified healthcare auditor program. But event flow diagramming can be extremely helpful to identify what happened, when it happened, the time that it happened, and what were the surrounding events that occurred. Now, when it comes to cause and effect diagramming, first, it's important to make sure you incorporate all four of the steps. The ID problem, identify what is the problem, brainstorm what could have caused it, complete the diagram, and then make your causal statements. Audits related to overpayments. That's a lot of my experience, although I have done some clinical and other types of compliance audits in my career. When it comes to Medicare, they have very specific rules regarding self-identified overpayments and very strict timelines in regards to when those overpayments have to be reported and refunded. Healthcare providers and suppliers have been and will remain subject to the statutory requirements found in the Social Security Act and could face potential False Claims Act liability, civil monetary penalties law liability, and could be excluded from the federal healthcare programs for failure to report and return an overpayment. For right now, the major provision of the rule is that an overpayment has to be reported and returned to CMS by the later of 60 days from the date from which the overpayment was identified or the date of when any corresponding cost report is due. Now, cost reports apply to institutional providers only. Finally, review to ensure the corrective action plan addresses the items on this slide, such as determining a root cause, description of proposed corrective actions to consider, application of any action to prevent it from happening again, deadlines, and current status of the action items. You can verify that the organization conforms to the intent of the requirements by setting forth corrective action plan using a PDCA, or Plan, Do, Check, Act technique. The P for plan, it's a plan, procedure, or method developed or establishes what needs to be done. The D for do is the plan, procedure, or method that's being followed. Do what was planned. Check the plan, procedure, or method is monitored and are measured against criteria. And A for act shows that action is taken to resolve the differences between expected and planned results. As we wrap up today's presentation, lead with strength. but through wisdom and kindness. People don't like being reviewed, their performance reviewed, or the policies and procedures being reviewed, documentation coding, systems that they designed. So you want to approach it with kindness, but you can also be firm. Uh, you're going to use wisdom and strength. And the harsher the message, the more kind and considerate you need to be in how you deliver that. That's going to really go a long way. Just put yourself in the auditing shoes. Be objective and reach for feedback so that they can say that the audit was fair. Okay, we have some time for Q&A. Oh, question. When there is a small sample size, do you audit all of the samples? There may be a time where what you're going to be auditing is it's a small universe. Benjamin, if you have anything specific, yeah, if you do end up auditing everything in the sample, there's nothing wrong with that, but I'm wondering what kind of audit you're doing. It sounds like you might be monitoring, but you can go ahead. Your audit size, your sample size can be any size that you feel is appropriate for the type of audit that you're doing. Here is a question. Do you have a standardized PERC audit findings report template that you can share? We have something similar to that, but you have to take our chalk course to have access to it. Let's see. Oh, Benjamin, you were auditing all office visits, and the office visit count was fairly small. Yeah, do all the office visits if you need to. That would be a fair thing to do, because if you have, let's say, 25 office visits and I would audit all 25, because doing a small sample would be kind of silly. I would just grab all of them and look at all of them. And let's see, we have another question. Do you consider 10 accounts statistically valid for a provider spot check? 10 accounts statistically valid of a universe of how many? It depends on the universe. And we have a couple of lessons that we do nothing but go over the different types of statistics that can be applied to sampling. But you need to look at the universe and make sure that you have enough in your sample that's going to be representative of what's actually happening. And that's why if you have a large organization, you might need a fairly good sized audit team to be able to take a look at a significant enough sample. If the sample size is too small, it's not representative of what's happening in the organization. Okay, and somebody asked, is the checklist different from what we went over today? In our course, there's a whole introduction into auditing, and the checklist that we went over today is at the beginning of our certified healthcare auditing or auditing for compliance course. And then throughout the entire course, we really drill down into every aspect into a lot of detail. All righty, you guys, it's the top of the hour. Thank you so much for attending today. The American Institute of Healthcare Compliance, we are a nonprofit organization. If you're not sure about the type of courses and training that you think that you need for your administrative career in healthcare, you can go to contact us on our website and just say that you would like some career counseling. Tell us a little bit about what you're currently doing and what you are looking for, and you'll be forwarded to one of the career counselors. I'm one of them. Teresa is another one. We have several people that will do career counseling. And we will encourage you to pursue the type of training that's best for you. That might be with our company. We might refer you to a different company. And if you're not qualified, we'll have you do some self-reflection. Organizations like education, college degrees, but that isn't the beginning and end of everything. If you have a certification, like as a coder, and then you get experience in documentation and medical terminology, and you start working in areas as a part of an audit team, that can help to pave a career for you as an auditor. But typically, people that are doing audits in healthcare have an extensive amount of experience in healthcare and experience in the field that they're auditing, and then have additional credentials to help back up to show that they are subject matter expert. So reach out to us for advice if you're not sure.